nice.
I know, it's so pretty.
Yeah.
Going next to it. It's like as big
Okay,
as my head.
I think we're live on YouTube. So yeah, we can
Oh.
let people in the waiting room and then I'm just gonna
Let's rename us.
hit record. Hey, everybody.
Morning, early morning. I'm gonna change your name too, because I think I
I'm
have.
doing it. I'm doing it. I got it.
Okay.
Hey, everybody. How's it going? Hi. Just gonna hit record. Great. You're here for the day one of our spring glow up. Hold, please. I'm just gonna make it so you cute people don't show yourselves.
It's
There
a
we
big
go.
Hillary.
It's always a mystery how we get started with these things, but we'll get better as it goes. Okay. It's both of us. Hey, good. And a great
Hi.
time. Hi, we're talking about histamine. Histamine, spring allergies. We're setting you up. We've got 5 days talking about allergies and all the great things that we do in our practices and with our patients and in our community to try to treat allergies. It's a big one. And springtime is when it often comes up.
Yeah, allergies are a big deal, but histamine, the thing that causes us those allergy responses, it's really interesting that it is the missing link between inflammation and mood issues. Like it is. It's now recognized. And you know what? I think we didn't have this as much when we were, in medical school, and we've been doctors so long that we didn't think about this because it wasn't a thing, right? Allergies used to be people have allergies. They have runny noses, they have runny eyes. Hillary's going to go through all the symptoms. It wasn't as much the mood and the insidious, you have 12, 15 symptoms across all body symptoms, like systems, like it's like everything hurts. It wasn't as much like that when we were kind of growing up. Now it's really common, and we're going to tell you why that is, right? There's a big issue going on here.
When we were growing up,
When we were growing up.
I grew up in the desert and everybody moved to the desert in general because it was like a less allergenic load. So obviously this is really like place dependent. Like Kara practices in Connecticut, and so there's a ton of moisture and dampness. I'm in Northern California. We have a lot of his allergies right here. So our allergy season, we tend to go like literally flu season straight into allergy season without a shoulder. You guys probably tend to have a bit more of a shoulder before your blooming season, but it's all a big question mark now with global warming and changing weather patterns, and everybody's experiencing something different. But generally, we want our patients or our communities to start to treat their allergies in February because getting ahead of your histamine cycle is the answer in for many of us to have a much better allergy season. So day 2, day 3, day 4, we're going to talk a lot about how to treat yourself, but we just want to set you guys up to understand what is histamine? Why is it impacting? Where am I feeling it? It's different for different people. Traditionally, when you think about histamines or you use antihistamines, you think about it because you have runny eyes. You think about it because you have a watery, stuffy nose. You're sneezy. You might be low energy. You might have a low grade fatigue, and you're assuming it's grasses or dust. Like that can happen if people are cleaning out an old storage cabinet, or if they're exposed to something that they have an allergy to, and they're creating all these symptoms. Kara, you struggle with it a little bit. It's a thing in your house. You guys have allergies.
Well, okay, so as a child, I always had fall allergies. And I knew, I would go to school and I'd be sneezing and just like runny nose, terrible in the fall. And that was ragweed probably. And then I used to have to, deal with allergies at people who had cats. Their houses were tough for me. And I would be, driving home just like sneezing, 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 that kind of thing. But in my adult life, I lived in Seattle. I didn't really have allergy symptoms out there. I didn't think about it so much. And then when I moved back to New England, I had really severe symptoms. And one of the interesting things that happened is that I brought my daughter to get allergy tested once, because she was having symptoms, especially in the fall. And they do those skin tests. It's an allergy test, and her, they did it on her. And I was like, well, I'm here. I want to do it too. Mine blew up like terrible, double as bad as hers. Every single thing they did 40 different things. And like 36 out of 40 were severe responses for me. And it was really interesting because it was the
That's so
things I
sad.
dust. I'm allergic to cleaning is a real thing. I'm totally allergic to cleaning. Dust fires me up. I already know that. I hate
We're
it.
making her a t-shirt. I'm allergic to cleaning. I
Yeah,
love
I mean, the allergist actually told me that I could justify having a housekeeper multiple days a week, which I was really happy about. I was like, that's great. And so anyway, so I'm bringing this story up. The reason why I'm telling you this backstory is that then I decided, because I was bringing my daughter for the allergy shots, I might as well do it anyway. And I'm telling you, I never knew I had really bad allergies like this. Like I knew I had them here and there, but it was just, I never took an antihistamine all the time. I didn't walk around identifying as like, I'm an allergic individual. It would be so rare, my episodes. Anyway, then I got the allergy shots, and I will tell you that my whole family knows about me with the allergy shots, that they'd be like, whoa, what's wrong with you? And I'm like, oh, I have my allergy shot today. 'Cause I get so angry with those things. And I am not like a fired up, like
your whole family
angry.
and your partner, your
And
business.
I get really like aggravated with those shots, and so I just want to say that's what we're talking about today, is like, why would that happen? Why would I just be so like a totally different personality for, 12 hours or something after those shots? It's unbelievable what happens to me.
So
I'm just not
histamine
nice.
is generally released from mast cells. It works as a neurotransmitter. It works in the brain. So it's one of the things that we see very high in kids with ADHD or people with anxiety or depression. So histamine is a mediator for many things deeper than just systemic allergies. But when you're in allergy season, or you already have a lot of histamines, these are some of the places you could have symptoms. As I say this, and my dog comes up. My dog sneezes like 10, like literally 100 times when she wakes up. So that's happening. So if you hear someone sneezing, it's not like special effects for our histamine talk. It's just my dog. But so histamine in the brain can cause anxiety, depression, brain fog, and really anger. Like we see anger a lot, or irritability. And so it can be like ADD kind of behavior, or straight up anxiety, or straight up depression. Okay. In the throat, it can cause major throat swelling. So that's what you know about if if a kid has a peanut allergy and they get an IgE mediated response that goes to anaphylaxis, you're going to get a lot of throat swelling. Here, it's what we talked about before: eyes, nose, running. The throat can be sore because there's a ton of postnasal drip. So there can be throat redness or soreness. The lungs, if they're really susceptible to histamine, there can be wheezing, there can be tightness, there can be shortness of breath. The heart histamine can cause palpitations in the heart. So when some women come in and they're like, okay, I'm having palpitations, I think, okay, this could be a stress response. This could be a histamine mediated response. In the gut, it's nausea, GERD, GI related, alternating constipation, diarrhea. Muscle soreness and pain can show up like fibromyalgia, bone pain. It's really interesting. Like we run detox programs and different programs, and some people will report bone pain. And like a lot of times that's the histamines that are working through. Urinary frequency. So that's a super fascinating one, because so many people will report like in springtime, like they have to pee all the time. They have to pee really frequently. They think they have a UTI, but they don't. It's one of the ways we can really check to see what's going on. And then there can be bladder irritation, and then there can be vaginal changes, vaginal itching, and even rectal itching. So it's just like, hello, it's a lot. It's pretty much every symptom that patients come to doctors in a given day, like that. When we are extending if somebody has anxiety, muscle pain, bladder spasticity, and a sore throat, they wake up with a sore throat, then we're thinking we're not trying to diagnose each thing, but we're trying to see that histamine can be an underlying mediator in what are the allergies that are playing in the person's life, or what are they, why are they making these reactions?
Yeah, and so those are all sort of the branches if you think of us like a tree. And what we're trying to get to is not those branches of symptoms. I have a headache, my nose is running, I have a sore throat, and I'm tired. Those are kind of the branches. What we want to get to is the trunk and really down to the roots, like what's the root cause of this thing that's causing all these symptoms, and not just chase each symptom around. And if we're talking about mood today, it's really, really interesting, this mood thing, because the brain has about four different receptors, where there are four receptors for histamine, different histamine receptors. And I think this is the thing I was talking about that we saw less of when we were younger, 20, 30, 40 years ago. Because people's brains had a better barrier. So there is a barrier system that you cross the blood-brain barrier. You've heard of this in many different occasions. But histamine really shouldn't be going into the brain. It shouldn't be spilling into the brain. There should be a really tight barrier where histamine doesn't cross and get in there. Just like in your gut, when people say you have leaky gut or gut permeability, it's the same exact situation. So if you do have leaky gut, gut permeability, GI issues, then you also have a leaky brain barrier, which we don't talk about very much in our culture, but that is how the histamine is causing us all these mood things. The amount of people I have seen in my practice in the last few weeks who just are sort of in tears and don't know why they feel so sad, and I really do think it's a histamine response. It's a lot. So I think that's a really big piece. And we now know that histamine regulates serotonin for people in depression. So it's really, directly regulating serotonin. So it's this really big picture that we just didn't have a grasp on. So we always need to think about the gut. People with IBS, you'd be very hard to find someone who has irritable bowel syndrome who doesn't have a histamine problem. They're just the gut, histamine, brain, mood is all connected. And that's kind of what we're bringing up for you all today. So if you feel a little off during a time where it could be an allergy season, this is why.
And the really fun thing is, in Chinese medicine, one of the things that we learned in school for Chinese medicine is this whole thing about liver qi stagnation. If you've ever been to an acupuncturist, it's a very common presentation for people, but it creates anger and irritation. And the liver is something that in Chinese medicine is always kind of impacted in springtime. Like, it's very connected to allergy, and it's connected to the way we process the world. And it can create this like fiery, angry, I can get very like liver qi stagnant if we have too much work. And it really can show up when people come in with allergies, that they're just like, ooh, on their like last rope, and in Chinese medicine, we're trying to like get the flow going, get things moving, right?
Absolutely. And
And
so if you're listening live, just write a Y in the chat if this happens to you. Like if you feel like you're noticing some mood issues along with your allergies, I just want to see a Y if you were having that happen to you.
the other neurological symptom that I forgot to say was headache. So a lot of times people can get a histamine triggered headache, a histamine triggered migraine. So we're always thinking about, for patients who have really bad seasonal allergies, or for patients who are living in or exposed to mold and mycotoxins. That's become a really big thing in medicine, because it's becoming more commonly known that long-term infections or long-term exposures that create inflammatory disorders kind of light up the histamine receptors in the brain. So a lot of times a patient will come to me and it doesn't seem to make a lot of sense. Like I said before, they have GERD or they have bone pain, and we're using antihistamines as a trial to see, okay, if you take antihistamines, how many systems do we get better? Long term, like Kara said, we don't want to treat the branches, we want to treat the trunk. And we'll let you know starting tomorrow all about natural medicines and natural remedies. Like, this is a place where natural medicine shines. And genetics really matter. Like in Kara's genetic test, she's has a high need for vitamin C. she doesn't manufacture as much vitamin C genetically. And vitamin C, as you have it, is one of the things that is very protective against allergy and histamine related issues. So we're going to talk treatment, lots of treatment, herbs, homeopathy, teas,
Will you
diet.
teach me how to manufacture it? Because that would be like a medical miracle.
Not manufacture it. She needs more. So she needs to
Yeah.
intake more. Yeah. Okay. Sorry, you're not a dog. But like what I mean is she needs
I
more
would love to be a
intake.
dog.
And a lot of that we learned from our
You know,
genetics. But it made sense, like when Kara got her genetic test done, she was like, oh, I understand now why I crave so much citrus or why I need so much citrus.
yeah.
And all that can be really helpful during allergy season or in the treatment of allergies, antihistamines, all the rest.
We have some people writing about headaches, and the histamine headache connection is unbelievable. I guess there's research on this. 85% of people with headaches, not just migraines, headaches, who go to doctors complaining about headaches, have a histamine issue. They have elevations in histamine if you do a blood level. And I guess 90% of those people will have improvement on a low histamine diet. So diet is a focus for us to talk about all the time. Sometimes people get relief there. You'll hear our opinions about, how to go about that, et cetera. But
And
it's
it's so
very
tricky because, of course, so many of the foods that are deemed health foods, or we think we're doing a great job, they're like the
Yeah.
most high in histamine food. So we'll cover like when it's important to do an antihistamine diet and when it's
exactly.
not.
Because
It's so
people
annoying.
don't know that histamine, we get histamine from food. I remember the first conference where I was sitting there with our nutritionist, and I was like, wait, what? Like there's all this histamine in these foods, and this is high histamine food, low histamine food. I had no idea. That was amazing when that research came out. That's amazing. So we have other sources in the body other than these allergens that we react to for histamine, and we'll get into those over the next few days.
We're so excited you
Well,
guys are here.
bye, everybody.
Hopefully you'll learn a lot over the next couple of days. Keep coming back. Bye.
Bye.